Morgan, a new patient visiting for a sore throat, is a 19-year-old girl who smokes marijuana frequently, and this is impacting her relationship with her significant other. They have been arguing a lot about it lately, and she is currently in the pre-contemplation stage because she hasn't thought about her marijuana use.
Hello, Morgan. My name is Olivia, and I will be your nurse today. Thank you for waiting so patiently. Why are you visiting us today?
Well, I have a sore throat and it's been pretty irritated lately.
Okay. Before we begin addressing your sore throat, is that alright if I ask you a few questions concerning your general health?
I guess that's okay.
Alright, great. In the past year, have you had 4 or more drinks in a day?
No, I haven't.
Okay. In a typical week, do you have more than 7 drinks?
No, I choose not to drink too much.
That's great. In the past year, have you drank more than you meant to?
No, I told you, I don't binge drink. This is getting kind of repetitive, don't you think?
I'm sorry, it can get a bit repetitive. This is a new screening procedure we ask all our patients. In the past year, have you used pot, other street drugs, or prescription drugs for non-medical reasons?
I mean, I smoke weed every once in a while when I hang out with my friends, but it's not really a big deal.
Okay. And have you used any tobacco products as well?
No, that stuff kills you. No one from this century smokes anymore if they have a brain.
Okay, next question. In the past year, have you thought about cutting down on your drinking or drug use?
Yeah, I guess you can say that.
Okay. In the past year, have you been under the influence of drugs when you could hurt yourself or others?
No, absolutely not.
Thanks for going through those screening questions. Since you answered yes to some of the questions in the screening, you resulted at a moderate risk. Is it alright if we discuss your drug use?
I guess, but I don't want you to act like I'm some hardcore drug addict.
No, of course not. Can you tell me about your typical day?
Well, honestly, it may seem like I don't do too much, but my boyfriend and I are greatly struggling to pay our rent, and it's creating some distress on our relationship. And with that, my boyfriend works a really low-paying job, so I've been looking for one to increase our monthly income, but I'm having a really hard time finding one.
Okay, I can definitely see some stress in your life. It takes courage to face such difficult problems.
Exactly, it's a lot of pressure.
So what I hear you saying is that your financial situation is causing you a lot of stress between you and your boyfriend and pressure in your everyday life. Can you tell me how marijuana use affects your day?
You could say that I smoke socially in the evening when I go out with friends, because when I'm high, it really helps me to relax.
So you feel like smoking with your friends is an easy way to relax?
Yeah, especially after I've had a stressful day.
Okay. And you stated that you smoke socially?
That's correct. My friends and I like to hang out and have a good time when we're high, and it helps us to let go a little bit and appreciate the small things in life.
Okay. Well, your marijuana use concerns me. It could be affecting your health.
I'm not too concerned about it right now. I came in with a sore throat, and now you're just wasting my time.
Okay, so you came in today to take care of your sore throat, and now this totally different concern comes up. I can see where that might be upsetting to you, and we are definitely going to take care of your sore throat today. Your marijuana use may be aggravating or even causing your sore throat, though. Do you see any way your marijuana use is connected to your sore throat?
Well, now that you say that, I guess the marijuana smoke could be making my symptoms worse. I know that smoke isn't good for your throat or your lungs.
You're absolutely right. Smoking isn't good for your lungs. I'm happy you see the possible connection. I'm worried your sore throat could be correlated to your marijuana use. Marijuana can make you very susceptible to multiple respiratory diseases. Now that we've talked about some of the health risks, can I offer you some advice?
As long as I'm here, I don't have anywhere else to be.
That's great. I know you didn't come here today to talk about your marijuana use, so I think it is great that you are willing to work with me. I'm glad you are willing to discuss this. Would you be willing to consider cutting back on your marijuana use?
I just don't see why I should.
It sounds like you are having trouble finding a reason to cut back.
Exactly.
Why don't you think cutting back is a reasonable idea?
I don't really think it's necessary. It doesn't seem like much of a problem to me.
So you're saying that you don't think it's necessary to cut back. It sounds like you feel like there is no problem. What do you like about smoking?
I enjoy the way it makes me feel. Like I said, it relaxes me, and it makes me feel like I don't have to worry about anything. I'm trying to go back to school, and trying to find and save the money has been really stressful.
Just so I understand correctly, you smoke marijuana because it makes you feel good. Also, you want to go to school, but finances are a problem for you.
Yeah, that's right.
Can you tell me about some of the consequences of smoking?
Well, I guess when I think about it, it's pretty expensive, and it's causing some problems between my boyfriend and I.
Okay, so on one side, smoking marijuana is fun and relaxing. However, it seems it's causing you some financial and relationship issues, which is influencing your ability to go back to school.
I guess.
Could you tell me how your drug use affects your relationship with your boyfriend?
Sure. Well, sometimes I use the grocery money to buy pot, and it really upsets him. And he also thinks that it affects how I interact with people, and I've almost gotten in trouble with the law a few times.
Wow, I appreciate your honesty. I know this may be difficult to discuss, but it sounds like it is causing you some major problems.
I guess. I've just never really looked at it that way.
What kind of goals do you have for yourself in the future?
I want to be married to my current boyfriend and possibly go back to school in hopes to build a foundation for my future.
Okay, now that we've discussed some of the negative aspects of your drug use, on a scale of 1 to 10, how ready are you to make a change?
I guess maybe a 3 or a 4.
Okay, that's interesting. Why not a 1 or a 2?
Well, because now that you've mentioned it, some of the negative effects of my smoking, like the physical and social issues that they've caused me, it may not be as great as I thought it was. And plus, my boyfriend hates the smell and is afraid that the smoking is affecting his health.
Here, Morgan is indicating that she is in the contemplation stage of change.
It takes courage to realize the negative effects of something you enjoy. What could be some not so good things about changing your behavior?
Well, if I stop smoking, I'll probably be more stressed and high-strung because I won't be able to use it as a relaxant. And I also won't sleep as well, which kind of worries me.
Those are some good points. So what you're saying is, you're worried changing your behavior would result in less sleep and more stress.
That's correct. I always use marijuana to ensure I get a good night's rest, and without it I don't sleep very well because the stress in my life distracts my thoughts.
Could you tell me some good things about changing your behavior?
I could find healthier ways to relieve stress, and if I were to stop, I'm sure my relationship with my boyfriend would get better too. And I wouldn't eat as much because I wouldn't get the munchies from smoking.
Those are good points. On one hand, you will gain a healthier lifestyle, and on the other hand, you will end up improving your relationships. So what are some actions you can change to promote this type of behavior?
I could definitely try to cut back on my smoking, say from once a day to 3 times a week until we meet again at the next appointment.
That's a really good one. What are some other things that you could do?
I could try running twice a week or so to cut back on stress, and then I could lose some of the weight that I've gained. And I'll apply to 3 places to get a job by the end of the week in hopes to raise money for college.
It's great that we have outlined some goals you are capable of reaching. I know you are greatly accomplished in life and willing to strive for these goals. Now that you have some ideas, on the scale from 1 to 10, how confident are you in making a change?
Maybe like a 5 or a 6.
Those are good numbers. I like to see that you are willing to change. Why did you pick those numbers?
Well, you've definitely changed my perspective a bit. I didn't go lower because now that I've listed out those goals, I've realized that they're very attainable. And I didn't say a 7 or an 8 because I'm a little intimidated by quitting something that has been a habit for so long.
I like to see that improvement and the fact that you remain open-minded. I will mark those goals in your chart so we can discuss them when you come back in a couple of weeks. Now I'm going to go get your test results for your sore throat.
Great, thanks for your help. I'll let you know how the next few weeks go.
Morgan is now in the preparation stage. She has made a plan and has committed to it.